today's video, we are going to talk about the similarities and differences between COVID-19 and influenza. Stay tuned till the end. As the COVID-19 outbreak continues to evolve, comparisons have been drawn to influenza. It's important for you to know about these two viruses and respond particularly. How are COVID-19 and influenza viruses similar? Firstly, COVID-19 and influenza viruses have a similar disease presentation. That is, they both cause respiratory disease, which presents as a wide range of illness, from asymptomatic or mild through to severe disease and death. Secondly, both viruses are transmitted by contact, droplets, and fomites. As a result, the same public health measures, such as hand hygiene and good respiratory etiquette, are important actions all can take to prevent infection. How are COVID-19 and influenza viruses different? The speed of transmission is an important point of difference between the two viruses. Influenza has a shorter median time from infection to appearance of symptoms, and a shorter time between successive cases than COVID-19 virus. The time between successive cases for COVID-19 virus is estimated to be 5 to 6 days, while for influenza virus, it is 3 days. This means that influenza can spread faster than COVID-19. The reproductive number, the number of secondary infections generated from one infected individual, is understood to be between 2 and 2.5 for COVID-19 virus, higher than for influenza. However, estimates for both COVID-19 and influenza viruses are very context and time specific, making direct comparisons more difficult. Children are important drivers of influenza virus transmission in the community. For COVID-19 virus, initial data indicates that children are less affected than adults and that clinical attack rates in the 0 to 19 age group are low. Further preliminary data from household transmission studies in China suggest that children are infected from adults, rather than vice versa. While the range of symptoms for the two viruses is similar, the fraction with severe disease appears to be different. For COVID-19, data to date suggest that 80% of infections are mild or asymptomatic, 15% are severe infection, requiring oxygen, and 5% are critical infections, requiring ventilation. These fractions of severe and critical infection would be higher than what is observed for influenza infection. Those most at risk for severe influenza infection are children, pregnant women, elderly, those with underlying chronic medical conditions, and those who are immunosuppressed. For COVID-19, the current understanding is that older age and underlying conditions increase the risk for severe infection. Mortality for COVID-19 appears higher than for influenza, especially seasonal influenza. The data we have so far indicate that the crude mortality ratio is between 3 to 4%. For seasonal influenza, mortality is usually well below 0.1%. However, mortality is to a large extent determined by access to and quality of health care.